All right. Hi, Mommy Berries community. I'm excited to have a twin on. You can see we're wearing the same thing today. We were supposed to be joined by one other person, but of course she's a mom and things never go as planned when you're a mom and so her healthcare flew out the door. So anyways, I'm excited to have Dr. Lauren Tomkins, a naturopathic doctor, with us today to talk a little bit about, like just to talk to you pregnant and postpartum women. And as I've mentioned before, like my whole goal with Mommy Berries is that we learn more about our pregnant and postpartum bodies so that we feel more empowered. And I, as a physical therapist, like people come to see me for their physical symptoms, like something's bothering them during pregnancy or postpartum, or they're trying to be proactive about their physical body. But um, like the physical nature is just one small piece of the puzzle. And I wanted Lauren to come on today to help me talk about hormones and kind of like how that all fits into the mix during pregnancy, but primarily postpartum. And so, Lauren, thank you for being here.
Yes, thank you for having me.
Yeah. And Lauren herself just celebrated the first birthday of her little guy. So not only does she treat lots of women like all of you, but she's been through it all herself in the last year. Yeah.
Mhm. Yes, it's been quite the
Oh
adventure
my
so
gosh.
far.
Isn't it? So it's like kind of nice to be put on the other side of it. So then you can relate. Like I'm sure now when your clients come in, you're like, yeah, I get that a little bit differently than I
Yeah,
did
a little bit
before.
differently now.
Yeah.
Yeah, for sure.
The one of the I kind of thought I would start kind of general with this conversation. And I wanted to say, because I hear a lot from my clients and you see a lot on the internet or on social media talking about, oh my gosh, my hormones postpartum. But then when you actually start to think about the details, I thought that's why you should come on and talk about it. Is like, let's talk about the details around that, Lauren, and like what exactly is happening in our body as like a postpartum woman. And so why don't you start? You tell me where you want to start. Do you want to start during pregnancy?
Yeah, so we can definitely talk during pregnancy. So when we get pregnant, our hormones increase and we get this nice, really large surge, especially when we look at like estrogen and progesterone, which are generally kind of the two big hormones that we talk about. And it's definitely after we give birth, both baby and the placenta, that we really start to have the biggest transitions in terms of those hormones that really start postpartum. And then there's different ways kind of throughout postpartum. I don't just think of postpartum as the first 6 weeks. I always think of postpartum for moms that I work with anytime after baby, especially we want to look at that first year in terms of recovery. And really, when we take a look at estrogen and progesterone, as soon as we give birth and the placenta comes out, we generally have a very steady decrease in the estrogen and progesterone. It goes down very, very quickly. And that's a big shock to the system, right? When we're used to having kind of these super physiological levels of the estrogen and progesterone for so long. At the same time, generally around day 3 postpartum, we also get a huge increase in prolactin and oxytocin. Oxytocin will also, they'll start increasing kind of within those first 3 days, but kind of markedly, generally people talk about that day 3 baby blues or this really big change in terms of how we start to feel after and kind of starting into the recovery aspect of it. And prolactin and oxytocin are really important for one, producing milk, and then also the actual letdown of milk. And of course, oxytocin is one of the big bonding hormones that we start to really feel after birth as well.
So Lauren, did you say that it's the drop in progesterone and estrogen that creates like the moodiness? Like that
It's kind of a combination of both. So not only are we having this, big drop in our estrogen and progesterone, but then we're also having this huge surge in the prolactin and
okay.
oxytocin. So it's kind of this combination of both sets of hormones that are transitioning and changing that can really, when people start to think of like the baby blues, kind of around that day 3, can generally kind of last for some women with even within the first 10 to 14 days postpartum. So that's where there can be some mood swings, anxiety. A lot of people feel very emotional. There's a lot of, sometimes crying and tears and kind of swinging from the ups and downs. A lot of that can be attributed to the swinging and the changes of these hormones going down and the other hormones coming up.
Totally. And so I can see, like, you said, okay, around day 3 is kind of like when that's kind of at like its height or whatever. But Obviously, that's something that I'm sure a lot of women will be like, oh my gosh, that was me for like a year. So, would you
Mhm.
say that a lot of that is still kind of like the effects of some of these hormone changes? Or would it be more just like, oh my gosh, you know what? There's so many things. There's all not only some hormone changes, you're not sleeping as much, your life is totally different. You know what I mean? Like it's so many things, but how much does like the hormone aspect fit into that?
Yeah, it's a really good question. And I hear that a lot of times because a lot of women that I work with are like, oh my goodness, my hormones, my hormones, my hormones. And yes, they play a huge role. There's no doubt about that. But I always take a look at it from really taking a look at the full body, right? Like, what are other aspects of our health that can also be contributing to this as well? Hormones are definitely going to play a huge role in terms of a lot of the different symptoms that we see on a day-to-day basis. Obviously, there's going to be other hormones that affect that too. Thyroid hormone changes a lot during pregnancy for some women, as well as postpartum. So that's definitely something we generally have to look at. Then you also have to think about within, again, those first 3 days or first couple of weeks, we get a huge change in adrenaline and cortisol too, right? Usually the adrenaline is dropping off within those first 3 days as well. So that kind of adrenaline high after delivery is slowly decreasing. And then obviously things are changing from a sleep pattern. So our cortisol can start to change in terms of that. And then our day to day starts to change too. So those are some other hormones that, along with the first hormones that I kind of talked about, are really important to take a look at. But I think it's important to remember that it's not just our hormones. And a lot of times that our hormones, they can kind of get a blame for a lot of things, but sometimes they're actually doing what we want them to do. We just have to help support the body through those transitions and then make sure that they're nice and balanced moving forward, so that a lot of these symptoms and things that people can experience don't necessarily continue within a year, right? Because I think it's one of those times where there's so much change and there's so much transition going on, and it's really a time, I find postpartum is really about replenishment and support, and kind of figuring out what areas need support kind of moving forward, because things have changed, right? And I think the other thing too is to remember that there's hormones can cause a lot of different symptoms. They can be a little bit confusing that way, but so can other things within the bottom. And everything looks sometimes the same. So it can be really confusing to be like, oh, is this my estrogen or progesterone, or perhaps it's iron, or it's thyroid, for example. So that's why I think taking a full look at that is actually really important. I generally recommend women think about getting some blood work done, usually anywhere between 6 weeks to 3 months. At least as a baseline to check, not necessarily of some of the hormones, but some of the other things that can be contributing to some of the symptoms that we can feel, such as low mood or anxiety, depression, fatigue, obviously. And so if you take a look at that, things like your iron, things like your vitamin B12, your thyroid hormones, and your cortisol can be other things that you can actually start looking at a lot sooner, and that I generally recommend women taking a look at sooner, just to make sure that if any of those are out, we can start supporting those and making sure that we help replenish the body that way, so that as we move longer postpartum and we start to see the different changes with the hormones, we can make sure that the other areas aren't playing an effect into those symptoms.
And when you were saying earlier, do you mean like before the 6 week period, or do you mean like when?
Usually I find with women, the first 6 weeks it goes by
Oh my
pretty
gosh,
fast.
yes,
And
yes.
sometimes they're not necessarily able to, there's already other appointments and check-ins that have to be done. So I generally kind of typically recommend, like, if someone comes and sees me and hasn't had some, routine blood work done within that first 6 weeks, or at least sometime in the first 3 months, I think it is important to get some of those baselines checked, just because a lot of women are anemic or low iron throughout pregnancy, and that can continue postpartum and lead into some symptoms. Thyroid can definitely change again postpartum for some women, so making sure that we're checking into that. So I always think it's important, at least within the first 3 months, to get some blood work done, and then considering testing some of the other hormones later on. Yeah.
Lauren, what about like what unique kind of factors do you look at with like a breastfeeding versus non-breastfeeding mom?
Yeah, it's a really good question. So when we look at moms who are breastfeeding, they're going to have high prolactin, and high prolactin is basically going to it generally suppresses our other hormones, looking at progesterone and looking at ovulation. So a lot of women who, when they are breastfeeding, they're not ovulating, and then they're not getting that same, I'll say, kind of rebalancing of the hormones, and not necessarily seeing their menstrual cycles come back as soon. So I would say typically for breastfeeding moms, usually we might start to see a bit of a decrease in the prolactin around 6 months, where we don't necessarily need this oversupply of milk to be coming anymore. And when that starts to decrease, then we'll start to see the ovaries start increasing the estrogen and progesterone and start to see a change. And then usually menstrual cycles will start to come back, typically anywhere but kind of between that 6 months to a year mark. Um, when we look at moms who are not breastfeeding, that can actually change a lot quicker because they're not typically, I mean, our prolactin and our oxytocin kind of keep increasing every time there's nipple stimulation and every time we're breastfeeding. When that's not occurring, that prolactin generally decreases. And then for a lot of women, they can actually start to see the estrogen and progesterone actually increase even within that first 6 to 12 weeks. So for a lot of women, they'll say that once they stop breastfeeding, or if they didn't even start breastfeeding, then they'll actually get their period back a lot sooner. So sometime within that first 3 months can be a lot more typical. So that's generally kind of the biggest difference. So when a woman is breastfeeding, I generally don't always test the hormones right away because they're kind of being controlled at that point. I usually like to wait until we actually get menstrual cycle back, and usually have 3 cycles as a baseline to see what is the body going to start doing naturally
Right.
in terms of the return of that menstrual cycle. And then if we need to do some further testing because there is, really heavy periods or painful periods, or a lot of increase in PMS or other hormonal symptoms kind of throughout that postpartum area that needs support, then testing can be a bit more indicated there. But if someone obviously has their menstrual cycle come back sooner, we can, if needed, do some testing a bit sooner. Obviously that changes. Some women do decide to go on, hormonal birth control or an IUD after baby as well. And so once we're getting that medication, it kind of takes over what the body would be doing from a hormone side too. So it really depends on the person in terms of kind of taking a look at that. But yeah.
What would you say then? So let's say, because I can think of someone that just recently asked me, and I was like, I don't think I'm qualified to answer this, but I know I'm not, but they asked, okay, like I've been done breastfeeding for a while and I've not got my period back. So let's say, because you kind of mentioned within a year, you'd kind of expect someone to have, even if they are breastfeeding, their cycle back. What would
Yeah.
you say would be kind of like something you would suggest to someone that says to you, I haven't got my period back yet since I had a baby? Like, what would you suggest they kind of go ask for first or whatever?
Yeah, so I mean, in terms of that, some women it can be a little bit longer than the ranges that I gave, and it doesn't necessarily mean that something's abnormal. It can just be where their levels are at. But usually at that point, I do recommend again getting some blood work done so we can take a look at the levels as a baseline to know, are we getting the signals from the brain to the ovaries? Are the ovaries producing enough of the levels, and to get a better sense of where they're at. And obviously making or taking into account if there is any, birth control or contraceptives that are playing a part with that. Stress is obviously a big thing that can affect a lot of women's menstrual cycles as well. And obviously stress increases a lot for women in the postpartum aspect. So, obviously taking a look at ways that we are managing stress, managing sleep cycles as well, and making sure that mom feels really supported in a lot of areas as much as possible can be an important aspect of that too. If they're on any other medications and stuff like that, making sure that we're kind of looking into other interactions and stuff that can be playing a role. And then also making sure that from a nutritional standpoint that we are getting as much of the important nutrients and, proteins and fats and all of that to actually be able to properly produce the hormones and get that re-regulated again. So again, it's really kind of looking at that full
Exactly.
body
I was
aspect.
gonna say, all of a sudden it started to sound like I did an interview with a gal named Brooke, a dietitian, and
Mhm.
she was able to, we talked about the same stuff. Like, it's about your diet too. Diet
Yes.
to help support the hormones.
Yeah.
When you were talking about breastfeeding moms, one thing that I see a lot of as someone that's coming in for like pelvic floor symptoms, or I'm leaking, or I have some prolapse postpartum, I often do a vaginal exam. And one of the things sometimes that I will notice of a postpartum woman is it almost looks like a menopausal woman in that the tissues look very frail or very white in color, or they just don't have the same color.
Mhm.
And so again, not my expertise as a physical therapist to diagnose it or to treat it, but that would be often something I send to their either to their primary care physician or to their naturopathic physician. But anyways, can you talk a little bit about kind of and I see that as a sign of low, low estrogen. And
Mhm.
so can you talk a little bit about that and why some postpartum women will have those symptoms?
Yeah, it's a really good question. And again, we can definitely, I do see that in a lot of patients. So a lot of times when we think about low estrogen, people think of like hot flashes, night sweats, vaginal dryness, or changes with the vaginal tissue or irritation. Obviously, it can play into mood swings and fluctuations with weight and things like that. So it definitely can be an indication that there would be some hormonal support that's needed. In terms of that, sometimes we can help kind of more from like a topical standpoint, like if we're thinking about treatment standpoint, or it's looking at how do we kind of help re-regulate the body from like looking at the brain to the ovaries connection in terms of supporting those hormones increasing again. Now obviously if they're breastfeeding, then again we have to take into effect that things are probably still they're being suppressed, right? Which would then make sense as to why the hormones are probably at a bit lower of a level. And I mean, depending on the person too, they might have lower levels than somebody else, which is why someone else isn't necessarily presenting with those symptoms. So it can be something that there still can be ways that it can be treated, I guess. Not necessarily always from a hormonal standpoint. Like I said, there can be other topical or things that can at least help, not necessarily always from a root cause side of things until we can kind of get some more kind of major switches down the
Yeah.
road, but at least from a symptomatic standpoint, for the time being, to help make sure that things are healing properly and making sure that there's not going to be any more irritation or lingering symptoms kind
Yeah.
of going forward. Yeah.
What about the other one that I get asked about a lot is relaxin. And so
Mhm.
and please correct me if I'm wrong, but I did a course once and I'm pretty sure I took away that relaxin's more tied to the placenta.
Yeah. I think the last thing that I read from relaxin, I mean, obviously relaxin is great. It's a hormone that allows us to relax our tissues. It helps with the being able to have the ligaments stretch, which is needed, especially as
Mhm,
I'm sure you know,
mhm,
to help kind of support the
mhm.
carrying of the baby, and then obviously through delivery. For a lot of women, I think one of the last things I read with the relaxin is that sometimes it can actually stay fairly high for some women, even within the first kind of like 3 to 4 months.
Yeah.
With that, I mean, progesterone can also play into the tissues as well. So it it's definitely like as far as I know, it's going to be decreasing. It's definitely not going to be as high as it
Yes.
was
Yes.
during, but I'd have to double check the source that I read, but definitely there can still be at least like a generally like a higher level, which is obviously why too, as I'm sure you know, in terms of like postpartum recovery and
Yeah.
support,
And
like going back into
pelvic pain. And
exercise,
yes,
pelvic,
exactly.
you have to be just making sure that you're being careful of how quickly you're doing certain
Yes.
things to make sure that you're not
Yes,
causing
and that's
more.
why I would say one of the reasons where I feel like a hormone gets the blame because I think
Yeah.
I hear a lot of that's like, well, I can't do that because I still have relaxin in my body or
Mhm.
whatever. I'm like, yeah, no. Like I would say that, you can't blame that forever because yes, your body has changed a lot to be able to have a baby. And at some point we do kind of need to take some active steps, I would say, to try to
Yeah.
kind of help it get back or, help it kind of get back on cycle kind of thing.
Mhm.
Right.
Mhm.
I
Yeah.
think is definitely a situation where I feel like it kind of gets the blame that that all of a sudden when the hormones just get back to quote unquote normal, that we'll just be normal, and sometimes we need to take some actionable steps to do that, right?
Yeah, and I think like that's where again it's the hormones definitely play a huge role, but they're not the only thing that's
Yes.
kind of going on. But I think it is really important to make sure that we do check in on them too, right? Because for a lot of women, if they had some sort of underlying hormonal imbalance before they got pregnant, when they come back postpartum, sometimes we go back to that rhythm of whatever that was for them, right? Which or sometimes for some women, they're like, I hear all of the time, they're like, oh man, like ever since having my baby, baby. My periods have been super heavy, super painful, really irregular, right? And that's signs and symptoms that there is a bit of a hormone imbalance going on. So again, just helping the body get back into that regular rhythm for women can be really important.
So I was kind of thinking to like tie this up. Like I would say from like a physical point of view, I look at this and like I'm a physical therapist. And so I would say I give people the tools to help recover from a physical point of view after. And that's where I created an online program that women can work through that kind of helps coax their tissues and their muscles back to feeling supportive and they feel strong again. But what I hear from you is you're definitely supporting people in a bunch of different ways. We've just talked about hormones today. And like you think about, like I listen to you talk, I'm like, well, of course, all of this is going to help the recovery of the things that I'm helping them with. Is that making sure that your body at like a chemical level is being supported
Yeah.
so that on a physical level it has the tools. And I wonder if like if you could then, and my recommendation to postpartum women is always like understand the changes your physical body's been through, understand that it has problems after, it's natural, but here are some tools to help you recover. I wonder if you could speak to, at the end of the day, one, from someone that's just gone through it for the last year, I want you to kind of bring in some of your personal experience here. And what would you suggest to someone that's listening in on this, that's just about to have a baby, or maybe that's just had a baby? Like what would be kind of like a couple recommendations that you've learned or that you would suggest to women based on this topic?
Yeah, I think my one of my biggest recommendation is always throughout pregnancy and in postpartum is create a team of healthcare practitioners around you that you trust and that you go to in order to get a proper assessment for where you're at, for how you're feeling and the symptoms that you're presenting, so that you can get a proper assessment done based on where you're at. Because I find a lot in terms of postpartum, we get a lot of information, right? Like everyone wants to share their stories and everyone's got tips and tricks and do it this way and do it that way, or this happened to me. But I think when it comes down to your health, it's really important that yes, you may be experiencing some things that either your friends or your sisters or whoever have experienced, but it's also really important to recognize that you could be going through a completely different postpartum journey than somebody else. And that's where individualized treatments in terms of getting an assessment done and making sure that whatever your body actually needs from a supportive side of things is getting dealt with, because that could be completely different than anybody else that you talk to. So that's definitely one that I think is key from that. And making sure that the people around you, if you're, I think the other big thing to remember is that you know your body best, right? Like no matter how many, specialists and people that you see, if something doesn't feel right, I think it's important again to reach out and get another opinion and see someone that you can talk to about these things who might just have a bit of a different approach to the healthcare, or is going to take again a look at all of the other things that are going on, right? Because there's, I think again, there's so many transitions and so many changes that can be happening postpartum, and it's all too often I hear a lot of people say like, but no, I feel like this isn't right, and I know that something is going on, but I'm just being told like, oh, you're sleep deprived, or oh, it's because of this and that, right? Without really kind of investigating it a little bit further. One of my favorite quotes from another colleague of mine is, being a mom is not a diagnosis. And I really love that quote. And it's really resonated with me even in the past year, because it's, yes, there are lots of big changes and transitions and lots of things can come up and there can be certain complications and all of that. But there is ways that we can support postpartum and through postpartum. And a lot of times I try to educate a lot of my pregnant patients that, the support postpartum, I think sometimes is the most important part. And it can definitely be just something that I really recommend everyone figures out who they can reach out to if they do need help, or if they feel like something isn't right within their body, so that you can ask the questions and you can educate yourself in terms of what's actually going on to make sure that you understand, right?
Totally. It's so valuable because you're right. You know yourself best and you need to be your best advocate, right?
Yeah, yeah.
On that
And I
note,
think, I
oh, go
guess
ahead.
one other thing is just to also note with that is that some of these changes are normal, right?
Yes.
They can be very common and they can be very normal, but sometimes I also think just being able to have that conversation and being understanding what for you could be something that is quite normal right now, but we can also take a look at some other aspects of your health to make sure that you do feel fully supported, right? Because I think sometimes too, it's not everything that changes postpartum is necessarily abnormal. Sometimes our hormones are doing exactly what they should be right now, even if it doesn't necessarily feel just right just yet. So that's where, again, just making sure that we're kind of looking at that full support.
Absolutely.
Yeah.
On that note, Lauren, will you tell everybody where, sorry, you work in my community of Kelowna, so people in Kelowna can find you. Will you tell them a little bit about kind of where to find you? And I'm going to get you to link it at the bottom of this interview anyway, but maybe just speak to where you are and the fact that you do online sessions.
Yeah, absolutely. So I work at a West Kelowna Integrative Health Center. So we're located, I guess, on the west side for Okanagan locals, but we see patients all throughout the valley and beyond. And yeah, mostly right now in my practice, I have just transitioned back from maternity leave. So I am mainly offering telemedicine appointments with my patients. So we're doing both video and or phone consults, depending, which a lot of people have actually loved so far. It's that we've seen a big change in a lot of that recently. So so check us out. Our website is www.westkelownaihc.com. And currently at the clinic, we've got 4 naturopathic doctors, 4 registered massage therapists, and a nutritionist on our team right now. So lots of different services, and definitely more in my practice. I see a lot of prenatal fertility support, pregnancy and postpartum and hormones. Hormones are always kind of a big thing because, again, when we look at health, we always jump to kind of hormones. So it's generally kind of looking at that full again, spectrum of all the hormones. So so definitely take a look. And if anyone has any questions, they can definitely reach out.
I always invite people to kind of list their questions at the bottom of this. And if there's anything we didn't talk about, please ask. This is how I decide like who to talk to and what questions to ask. So your questions help me put together this content. Thank you so much for your time. We're doing this on a weekend. We were both just saying sometimes weekends work better as moms. And so I appreciate you doing this for the benefit of everybody listening. And we look forward to more of what you had to say in the future, Lauren, once I hear what everybody else wants to know more about. Okay?
Sounds good. Thanks so much for having me.
Yes. Thank you.